Asthma is a chronic respiratory condition that affects millions worldwide. It's marked by inflammation and narrowing of the airways, leading to breathing difficulties. While it's common in both children and adults, asthma can affect anyone, regardless of age. During an asthma attack, the muscles around your airways tighten, the airways become swollen, and mucus production increases. This can make breathing incredibly difficult, leading to symptoms like wheezing, coughing, and shortness of breath. Key takeaways. 1. Asthma is a chronic lung condition. 2. It's caused by the narrowing and inflammation of the airways. 3. Common during both childhood and adulthood. Asthma has several underlying causes, but it can be broadly categorized into two groups: genetic and environmental. Let's take a look at these in more detail. Family history plays a significant role in asthma. If one or both of your parents have asthma, you're more likely to develop it. Air quality, pollutants, and exposure to allergens are major environmental triggers. Cities with high pollution rates see more asthma cases. Certain jobs expose people to dust, chemicals, and fumes that can trigger asthma. Workers in manufacturing, farming, and even hairdressing are at higher risk. Respiratory infections, especially during early childhood, can increase the risk. Obesity is another factor, as excess weight can put pressure on the lungs, making breathing harder. Asthma can manifest differently depending on the individual. However, some symptoms are common across most asthma sufferers. Wheezing is a high-pitched sound heard when breathing. It's caused by the narrowing of the airways. Persistent coughing, especially at night or early in the morning, is a sign of asthma. Feeling like you can't get enough air and experiencing tightness in your chest are signs that your airways are constricted. Asthma isn't the same for everyone. There are several types, and each requires a different approach to management and treatment. 1. Allergic asthma, triggered by allergens like pollen, dust mites, or pet dander. It's the most common type of asthma. 2. Exercise-induced asthma, often triggered during physical activity, particularly in cold or dry environments. 3. Occupational asthma. As mentioned earlier, this type occurs due to exposure to substances at work. Diagnosing asthma requires a combination of medical history, physical examination, and specific tests. 1. Medical history and physical exam. Your doctor will ask about your symptoms and family history. They will also conduct a physical examination to check for signs of asthma. 2. Spirometry and peak flow tests. These tests measure how much air you can exhale and how fast, helping doctors assess your lung function. Once you've been diagnosed with asthma, it's important to manage it by avoiding triggers. These can vary from person to person, but here are the most common ones. 1. Allergens. Pollen, dust mites, mold, and pet dander are common culprits. Keeping your living space clean and avoiding pets can help. 2. Smoke and pollution. Cigarette smoke, pollution, and fumes can worsen asthma. It's crucial to avoid smoking and limit exposure to polluted areas. 3. Weather conditions. Cold, dry air can trigger asthma attacks. Wearing a scarf over your mouth in cold weather can help. While asthma cannot be cured, it can be effectively managed with the right treatment plan. Let's look at the most common treatments. 1. Quick relief medications. Rescue inhalers. These inhalers provide immediate relief by relaxing the muscles around your airways. 2. Long-term control medications. These are taken daily to reduce inflammation and prevent asthma attacks. They include corticosteroids and leukotriene modifiers. 3. Bronchial thermoplasty. For severe asthma cases, bronchial thermoplasty is a procedure that reduces the muscle tissue in the airways, making it easier to breathe. 4. Natural remedies and lifestyle changes. Breathing exercises, diet changes, and regular exercise can improve lung function and overall health. While asthma can't be cured, there are steps you can take to reduce the likelihood of attacks and manage symptoms effectively. 1. Allergy management. Avoiding allergens by keeping your living space clean and using air purifiers can prevent attacks. 2. Proper medication use. Always take your prescribed medication as directed by your doctor, even when you're feeling well. 3. Regular checkups. Visit your doctor regularly to review your asthma plan and make any necessary adjustments. 4. Lifestyle modifications. Quit smoking, avoid secondhand smoke, and engage in regular but moderate exercise to improve overall health. Asthma can feel overwhelming at times, but with the right knowledge and treatment plan, you can live a full, active life. Remember, asthma is manageable. By identifying triggers, using medications properly, and living a healthy lifestyle, you can control your asthma symptoms and prevent attacks. Don't forget to subscribe, hit the bell icon, like, and share this video with your family and friends.